Right, good afternoon everybody and welcome to the BCP Council Health and Wellbeing Board this afternoon. We've all had our sort of agenda and papers sent round. So firstly, if I can just ask our Democratic Support Officer to read out the housekeeping rules.
Thank you, Chair. Please note that this meeting is being recorded by the Council for live broadcast and will be published on the Council website for a minimum of 6 months. The meeting may also be recorded or streamed for live or subsequent broadcast by members of the public, although ultimate discretion in this matter lies with the Chair. For those in the room, please note that if the fire alarm sounds, please exit by way of the building by way of the nearest available signed fire exit route and make your way to the assembly point at the War Memorial in the gardens opposite the front of this building in Bourne Avenue. Finally, please ensure background noise is kept to a minimum and mobile phones and other devices are turned off or switched to silent for the duration of the meeting. For those in the room, this includes turning off your microphones and turning down the volume on your laptops completely. Thank you.
Right, thanks very much for that. I'll now move on to the agenda items for this meeting. We actually have a number of sort of important discussions to have this afternoon. I will say the meetings tend to run from 2 till usually we finish by about 4 o'clock. A number of us have another meeting to go to at 4 o'clock. So I will try and, as chair, try and keep us on time and on track for that. But in the best radio show approach, I think if we could all speak without hesitation, repetition or deviation, then that would be much appreciated. So okay, first agenda item, apologies.
Apologies have been received from Matthew Byron, Peter Browning, Betty Butlin, Aidan Dunn and Dawn Dawson this afternoon, and Ellie Lindop is substituting for Dawn Dawson.
Right, thank you. Was any other apologies or substitutes? Was there?
Hi, Kate Parker from Community Action Network, and I'm here in place of Karen Loftus.
Thank you, Kate. Right, okay. Actually, could you take your microphone off, Kate? Thank you. Right, the minutes of the last meeting on the 12th of January 2026, which have been circulated. Did anybody have any comments or amendments on the minutes of the last meeting? Rob, did you want to?
Yeah, thanks, Chair. Just in relation to, on page 7, in relation to the neighbourhood health plan, the actions on that page, just an update that the neighbourhood health plan requirement is now for the end of April, not the end of March. And we're still awaiting national guidance on what that plan should contain. So we will look to bring that plan to Health and Wellbeing Board in June. Okay,
that's great. So that's not an amendment to the minutes. The minutes were right, but it's a matter arising effectively. Yeah, it's been updated. Thank you for that update. That's helpful. Any other comments on the minutes? Is everybody happy to approve those as an accurate record, and I will sign those off? Yep. Okay, good. Any declarations of interest? So has anybody got any declarations to make? No, I'm not seeing any. If anything occurs during the meeting, then please raise your hand and let us know as we go through. Public issues. Are there any public issues for this meeting?
There are no public issues, Chair.
No. Okay, great. Now I often do introductions, but I think we all probably know each other here. I know Kate obviously attending in place of Karen this time, but probably don't need to do introductions. I think we all know who each other is now. So okay, we'll skip that. So okay, items of business. Agenda item 6. So the NHS Dorset ICB 5-year commissioning plan. Yeah, so we've got Bex Kendall, Deputy Director of Performance and Planning, to present this report. Actually, I've noticed we've got a few people online as well, haven't we? So, Bex, did you want to present this report? So.
want me to start? Hi everybody. Thank you for inviting me again. As you know, in January we shared a very high-level overview of our commissioning plan with you, as we were still working through the detail at that stage. But subsequently, following the meeting, we did share the more detailed draft version of our plan, and you kindly provided feedback, which has now been reflected in our final version. As you know, the plan sits within the National Planning Framework, which shifts the NHS to longer term planning, which is locally led, improvement and focuses on prevention, digital transformation and quality. So really looking at that sort of left shift, as we're calling it at the moment, within the NHS. And our plan has been informed by a full needs assessment, which includes both the BCP and Dorset Joint Strategic Needs Assessment. We've also included and completed the public insights work, which included a review of over 38 insight reports, which came across the whole sector from health, the local authority and other partners. We've also engaged with our Dorset system partners as well as to enable us to pull together the final plan. As you'll have seen, the plan is strategic in its nature, and the detail for the delivery will be seen in the programmes, and will be seen in the respective provider plans, place plans and neighbourhood plans as we move forward. You'll have seen the priorities which are set out within paragraph 2.2 of the paper, and you'll see we focus very much on neighbourhood health, children and young people, mental health, learning disabilities and autism, maternity, UEC and planned care. And through these programmes, we're really aiming to improve the outcomes, reduce inequalities and improve the effective use of resources. Through the work that we're doing. We do have 3 supporting programmes which are around estates and infrastructure, digital and data and finance. As mentioned previously at the meeting in January, the plan is iterative and it will be reviewed and updated regularly. And as we've already mentioned, as we move forward, they will be reflected in the development place and neighbourhood plans. But it's also important to note that our plan aligns to our cluster partners as well. So we've made sure that within Dorset, Somerset and BSW that our plans fully align to ensure that as we move forward into the cluster ICB, we'll have that continuity and that future looking across the 3 ICBs. And what we're asking you to do today is to note and endorse our plan.
Okay, thank you for that. Yeah, the plan is quite a long 5-year commissioning plan that's been circulated.
Welcome that this was circulated and that we had the opportunity to feed in our comments. I know that we sent quite comprehensive comments, so thank you to colleagues in the ICB for taking those on board. I appreciate that. And I think, Bex, just to highlight again something that you just referenced there, the importance of this being iterative and how these strategic commissioning intentions, there'll be a number of different commissioning activities that we undertake alongside health partners as we move forward, and it'll be really important that we keep that alignment and that we think about it particularly in the context of neighbourhood plans, but indeed in all of our joint working together. So I think this gives us a really firm foundation, Chair, and really welcome all of the work that's gone into it. Also the evidence-based approach, so welcome that this has got the JSNA input into it and the consistency. So thank you to ICB colleagues for bringing this forward in the updated version that it's in.
Okay, thank you for that. Any other, Siobhan, did you want to?
Yes, hi there. I mean, I just, when you read it, it's quite amazing really in the current sort of turmoil around the system that our teams, and well done, you know, in terms of having developed this strategy. And just, I think the really exciting thing for us all is really thinking about neighbourhood health in Dorset and in the BCP area. And actually, you know, here I am working in hospitals. And actually, I think the neighbourhood health agenda is something that we all are enthusiastic about and actually want to really make that sort of vehicle that enables us to shift care from hospitals to community and to work on prevention rather than disease.
Thank you for those comments. Rob, did you want to?
Yeah, thanks, Bex. Also wanted to endorse the plan. I think it's great that our feedback has been taken on board in relation to neighbourhood health, children and young people, but also it really does have a clear focus on prevention, on reducing inequalities, the wider determinants of health is in there as well. Plus, there's a real commitment that comes through in the plan to design future services with people and communities, and really keen to look at how we can work together on that going forward in the context of neighbourhood health and wellbeing.
Thanks for those comments, Rob. Yeah. Any other comments? I'm not hearing any disagreements, so I don't think it's going to be too difficult for us to endorse this. My only comments were actually that it's really good to see this. You know, it's obviously sort of quite lengthy and detailed, and obviously sort of colleagues have had some input to that. And actually, I'm really pleased in the last month or so we've had a couple of meetings with yourselves and ICB colleagues to sort of help discuss the sort of governance and moving forward with the sort of plans for the ICB cluster. So I found those really sort of useful discussions and engagements, and yeah, just want to sort of encourage that approach, that we continue to talk to colleagues right across sort of Dorset, Somerset and Wiltshire to actually sort of make sure that, you know, it's going to be a bit of a bumpy ride, I suspect, you know, the sort of change, forming the ICB cluster and everything, but actually the signs for me so far actually that we're having some sort of quite constructive conversations and discussions about that to make sure we're not taking our eye off the ball in terms of what we're aiming to deliver. So if there's any other comments or not, then just check what we're asked to do. We were asked to note the ICB 5-year commissioning plan and endorse the ICB 5-year commissioning plan. So is everybody happy to endorse that plan? So that getting nods all round, so fantastic. Thank you for that, Bex. Thank you for presenting it, and I can confirm that, yeah, Health and Wellbeing Board are happy and satisfied with that, so thank you very much.
Thank you all. Thank you, Chair.
Right. Okay, that's the safety. Okay, we're just going to slightly juggle the agenda because I've got a colleague Kat isn't available as yet. Obviously thought we were going to spend longer talking about ICB plan stuff. So we will jump from, so we've just completed agenda item 6. We'll jump on to agenda item 8, if that's okay, developing a place-based partnership for BCP. Invite Laura to talk us through this. Thank you.
Thank you, Chair. Yeah, so I'll take the report as read, but if I may, I'll just highlight a couple of key points for board members. So the paper sets out the background, rationale and purpose of having a place-based partnership for Bournemouth, Christchurch and Poole with our health colleagues and system partners. As we know, there have been many changes, in particular in our ICB recently, as we've just heard. And following national announcements, as we know, ICBs are now clustering. So we have a much larger footprint, if you like, for our cluster, which includes Bournemouth, Christchurch and Poole, Dorset, Somerset and Baines, Swindon and Wiltshire as it currently stands. So that is 6 places, population of around 2.5 million. So what the ICB have been in conversations with each of the local authorities about is just trying to get a bit more momentum on establishing those place-based partnerships. Now, this isn't a new conversation. I know that here in particular, over the last couple of years, there's been that ambition and that desire to get a place-based partnership in place. But I think we can all agree that now it's really timely that we look to move on this a bit quicker, with a little bit more impetus, and to think about the parameters of what that place-based partnership will be looking at in particular. So we've worked collaboratively to put the proposals together that are in the paper today. What you'll see is that, yes, there is that focus on a 10-year plan and the 3 shifts, neighbourhoods, and indeed the strategic commissioning function. But there are many other things that the place-based partnership could be talking about as well, and they're set out in the paper. Effectively, what we're talking about when we talk about a place-based partnership is an executive system group that's able to drive forward and think about system working. So you'll see in the paper that we've described what the roles and responsibilities would be. Initially, we'd be looking at those roles and responsibilities being delegated. So from the Integrated Care Board, and obviously I'm here alongside colleagues today who we've worked jointly with, but also budget responsibility in due course. Now, the suggestion is that we would start small, and then as we mature as a partnership, that could develop. So things like the Better Care Fund, for example, would be a really obvious one that we could start with. And that, of course, is something that would be subject to review in the next year or so. And we'll hear a bit more about that from Scott and colleagues later. So I think the key thing for this board to remember is that the Health and Wellbeing Board would remain as the overarching governance. So this board would have a really important role in terms of that oversight and governance role. Health and Wellbeing boards are actually set out with a statutory function in the 10-year plan around place-based partnerships and neighbourhood plans. So that would still remain. So really, Chair, I think what the paper seeks is to ask views of the Health and Wellbeing Board. Is there anything else that we may not have brought together in this paper? And then subject to those views to take further soundings from wider stakeholders and other members with a view to setting up that place-based partnership in April, so that we are ready in a timely way when the ICB are ready to think about how they delegate some of those functions and commissioning responsibilities. We're also asking, Chair, as part of that, that one of the first things a partnership might want to look at is a session, a workshop around neighbourhood plans. As we've heard from Siobhan, that's going to be the really exciting thing that galvanises us all. And actually, I think neighbourhood plans will probably be the only game in town when it comes to strategic commissioning as we look at the national landscape moving forward. So, Chair, I'll pause there and happy to answer any questions with colleagues who have contributed to the paper and hear views.
Great, thank you for that. I think, yeah, that's helped me actually clarifying a few things in my mind. Yeah, so we've got time for a bit of a sort of discussion around these plans for the place-based partnership. Who wants to go first? Assuming there'll be a number of people wanted to comment. So, Mark, did you want to comment?
I'll get us started then. I suppose just to build on what Laura said, really, we've had stuff come through the Health and Wellbeing Board over the last year or so around place-based partnership for BCP, and I think it's really ripe now for us to push on. And we've had some challenges, and they're laid out within the paper. I guess you can see, but the opportunity there now with the clustering arrangements from an ICB perspective, but also the wider sort of system partnership working across health, social care, voluntary sector, and wider partners is there to sort of corral us around the neighbourhood health plans. And I think it's really, really important that we don't get hung up on neighbourhood health being just about health in its traditional sense. So it's really an opportunity for us to bring a partnership together and use that to begin with, really, to sort of push forward and develop those neighbourhood health plans, much like what Rob said at the outset around sort of the deadlines that we've got to get in the plan around. It will help us inform that. I suppose the other thing I would say is, I lost my train of thought completely. Hang on. Yeah, I think it's sort of the changes that are happening in the city and really want to get up and running. Thank you.
Thank you for that. And I think for me is that understanding that governance, making sure we're not duplicating things, but obviously it's in line with where the ICB is moving, and which I guess makes sure you're in line with the government's 10-year health plan and the whole sort of shifting priorities within that, but as well as come through Health and Wellbeing Board, so that we make sure that, well, both as local authority and all the other partners have that sort of voice and influence through this sort of governance regime. And I think it raises for me a little bit more about who sits on Health and Wellbeing Board and the voices that we have here, because we've obviously got the sort of community and voluntary sector, we've got children's, adults, hospitals, the whole sort of range. But certainly I know after the last Health and Wellbeing Board we had a conversation that at previous integrated care partnership meetings we had the voice of sort of employers and the skills and education sector as well was there, and that's not a voice that we have sort of at the Health and Wellbeing Board. And so yeah, it starts to sort of, if this is going to be the forum that we make sure that the services are delivered effectively, whether we want to think about some changes ourselves in terms of the Health and Wellbeing Board to make sure that we do have all the voices at the table, and that anything that has been lost through the sort of ending of the integrated care partnerships is sort of still heard effectively. So Siobhan.
Yeah, I really welcome this paper. I think it's really, really good to see. I suppose to some extent, this is the bit we've been missing. So I think it's really good to have it here. A bit of a plea, I suppose, that we really take some of the learning from what we've done in the past to just really focus on delivery and a degree of pace in what we're doing, because there is a risk sometimes these become lots of different fora where actually we talk a lot about governance, but we don't get on and do. And actually, I sense we're at a point where we all want to get on and do. And I think you're right, actually, Chair. It will sort of iterate. So how this gets on will then influence how the Health and Wellbeing Board evolves, you know. So actually I think one thing will begin to influence the other, but I really support the paper.
Thank you for that. Any other thoughts or comments to input to the discussion? I mean, I think for me, because we've talked about place-based partnerships for a long time, but actually it's then, for me, it's the point obviously talking about it's an executive, a sort of officer-led executive delivery group that will then form and actually sort of start to push those agendas forward, and actually, rather than being a sort of another board committee talking shop type of thing, actually it's when those sort of budget responsibilities and influences. So if we do start to see, you know, things like the things it talks about here, but also things like the Better Care Fund being included in that, then I see this as really, like you say, our sort of action and delivery route to where, you know, because often over many years I think been frustrations with health and wellbeing boards are a statutory body, but they're a sort of oversight body, but not with budgets and not with delivery, not saying, you know, go and spend this, you've got this budget to do this, that and the other. It's very, it's so the sort of actually seeing those actions happen. But I think this place-based partnership is really where we'd start to sort of, and I think it will, like you say, it will iterate, but this is really where I hope we'd be able to see actually some of those actions and things changing, and actually projects being delivered. And so any other thoughts or comments to input to the discussion? Zena?
Yeah, if I can just say as well, a good few years ago, there used to be a joint commissioning board with the local authorities and the ICB, and I think we sort of missed that once that got disbanded, because there wasn't a place really where we could share, especially when we're looking at commissioning intentions, there wasn't that place where we could come together where we share good practice or things that actually commissioning practice was being shared across Dorset. So obviously I really support this because I think that would give us that vehicle again as part of it.
Okay, good. Rob, did you want to?
Yeah, just to agree and building on what Zena said, I think there's a real opportunity here with the development of a place-based partnership. There's a clear commitment from the ICB in its target operating model to look at delegating commissioning to place. So recognising that as they cluster and they take on more of a strategic commissioning role on a much broader geography, there's an opportunity for us to design things more locally with that. And our place-based partnership is essential really in terms of providing that delivery vehicle to be able to receive some of that delegated commissioning responsibility too. And as Laura said, the plan will be to start small and almost demonstrate our value and our worth. And when we can do that, I think what we'll see over time is an increase in delegated commissioning responsibility from the ICB cluster to the partnership. So there's a real opportunity for us to design and co-design local services for local people at place. So I really support the development of the partnership.
Thanks for that. And I think for me that, you know, if there was any residents listening into our Health and Wellbeing Board, which there could be, or and they want to sort of say, well, okay, this is all very well, we've got these strategies, these structures, this governance discussion, what's it going to mean for me? And I think the fear that, you know, having an ICB cluster means that actually those decisions are more remote will be covered off by this place-based partnership, because actually we're the ones that know our local communities as best as we can, and we do the sort of JSNA and all of those sorts of things to actually make sure we understand the needs and the sort of local issues actually that we need to deliver. So in terms of what residents would see at the end of the day is actually hopefully the right services being delivered in the right areas in the right way for them by having the place-based partnership, as opposed to, oh, we know you've got this issue, but this is the offer that we've got, and it might not align with what you need, but this is what the cluster has strategically commissioned for your area. So it's actually making sure that actually what is commissioned and what is delivered on the ground for our residents is actually in line with the needs that they are now and that they are as they develop in the future, isn't it? So I guess that's really where the place-based partnership, the role that we'll develop to make sure. So any other comments or points? Kate, did you want
This
to come
might
in?
be a really silly question, so forgive, but I'm just thinking about how this will be kind of communicated to the communities and the neighbourhoods, and how that messaging will get out. Obviously, there might be people really interested in listening in on this call and searching up things, but are we actively looking to message out at this point?
So, yeah, Laura, did you want to?
Yeah, it's not a silly question. It's a very good question, and I think it's one that we need to work through. We are obviously working alongside the ICB because all of the other 5 places need to think about what arrangements they will have. So it will also be discussed, as you would expect, in the public meeting for the ICB. But I think it's right and appropriate that we think about what our messaging is. I also think it's right and appropriate that we think about participation in the place-based partnership. So I think, you know, we talk about co-production, but I think we have to genuinely mean co-production. We talk about lived voice. They need to be appropriate and meaningful opportunities to bring in the lived voice. So we have definitely thought about that. But the wider comms messaging, I think, is a really good point. So we'll take that one away, working with colleagues and making sure that we're consistent.
I think that's a good point about the co-production and the lived voice and how we take that into account. And that is where I would hope that we deal with those sorts of issues about health inequalities as well, because that's been a big issue, and we've had lots of conversations and discussion to make sure that we address health inequalities, and that can't so much be done at an ICB cluster level, but very much in a place-based partnership level, knowing our sort of local area and the sort of local issues. That's where we'll be able to address those inequalities, which is going to be continuing. Sort of, it's not, oh, we'll deal with health inequalities now we've done that. It's going to be constant, isn't it? Ongoing. So thank you for those points, and thank you for raising that question, Kate. That was useful. I think I did have one other question. I know we've got our chair of the Health and Adult Social Care Overview and Scrutiny Board online listening in. Just in terms of the relationship with the council's own overview and scrutiny, I mean, I guess they can ask to scrutinise any sorts of governance or arrangements as well, whether if they wanted to sort of look at our place-based partnership arrangements and how that was going to be planned and developed, just the sort of relationship with our own overview and scrutiny.
Yeah, I think that's right and appropriate. We've had some initial conversations. I think neighbourhood plans as well. So to Siobhan's point, I think it's the actual delivery. So the overview and scrutiny would be around, you know, not just the arrangements and the governance, as it were, but how did we get that public participation in what it is that we're commissioning, and is what we're commissioning effective for our communities, and is it meeting their needs? I think it's that nature of conversation that we'd be looking to have, and I think that would come through the neighbourhood plan work specifically. But yeah, we can also bring the place-based partnership if helpful.
Okay, thanks for that. Any other points that anybody wants to raise in our discussion on this? And what we're asked to do is that we discuss the proposals and give our views, which I think we've and so thanks, Laura, for the sort of the briefing and covering it. Subject to the views of the Health and Wellbeing Board, that the Wellbeing Directorate progresses in briefings with relevant members and wider stakeholders in setting up the place-based partnership, and that workshop session on place-based partnership working and neighbourhood plans is scheduled for DSG, CMB Cabinet and the Health and Wellbeing Board. Is everybody happy with those recommendations, happy to approve that approach and for us to move on to the next stage and actually form this partnership? Everybody's nodding, yeah. Thank you very much. Good, that's a good step forward. And yeah, I'm sure it's going to be on the Health and Wellbeing Board agenda for sort of years to come now. So that's excellent. Thank you for that. Right, I see Kat's joined us online. Welcome, Kat. So we've just covered agenda item 6 and 8, so we'll jump back to agenda item 7 now, the BCP Community Safety Partnership annual report, which I know, Kat, you're here to present that item. So if I can ask you to go ahead with that.
Thank you, and apologies, Chair. I was just jumping between meetings. Let me bring up my presentation. Okay, is that showing for colleagues?
Yes, that looks fine.
Thank you very much indeed. So it's a statutory requirement of community safety partnerships that they produce an annual report, which goes to scrutiny every year to look at the activities that partners and the partnership activities undertaking. In Bournemouth, Christchurch and Poole, we take that to the overview and scrutiny board, which took place in February this year, to look at what we're doing and to be almost like a critical friend to make sure that we are undertaking what we need to in line with the number of different legislations that we need to. So the role that BCP Overview and Scrutiny Board undertakes is to look at providing constructive challenge at a strategic level about what we're doing. It should be looking at the entire partnership. And if issues arise that relate specifically to a particular partner agency, it's more relevant to actually ask those questions, and then we can direct them those particular relevant authorities, such as the Fire and Rescue Authority or the Police and Crime Commissioner or Probation Services. And it should look at what the partnership activity is doing. It shouldn't be scrutinising specific activity of perhaps the council or partner agencies. It should be looking at the added value that we bring in relation to BCP in terms of a community safety partnership. And so the key roles of community safety partnerships and the statutory authorities, I mentioned, it's the council, the police, the fire and rescue authorities, probation services and health. The statutory requirement is to look at establishing a strategic group to oversee the direction of community safety partnerships, to set up partnerships, protocols and systems for sharing information, to identify priorities, which we do via an annual strategic assessment, which is currently taking place, to produce a partnership plan and monitor progress against it, to develop strategies to reduce reoffending, substance misuse and domestic abuse, and to commission, unfortunately, domestic homicide reviews, of which we currently have 6 taking place in the Bournemouth, Christchurch and Poole area. So the community safety partnership priorities for Bournemouth, Christchurch and Poole are to reduce serious violence. This is a requirement under the serious violence duty, which came into effect in 2023. To reduce violence against women and girls. Further guidance is due to be released within the next couple of months about specific requirements for us, and to reduce antisocial behaviour, drug-related antisocial behaviour, and specifically crime hotspots. So I know this is a really hard slide to read, but hopefully you've had a chance to look at the papers in advance. What this shows you, if you look at specifically at the different coloured lines, I'll start over here, the highest level, the dark blue is sexual assault, you'll see here, and then it goes down in terms of the specific types of crime. It shows you over a 12-month rolling profile what is happening in relation to serious violent crime in the Bournemouth, Christchurch and Poole area. And the reason we look at it in relation to a 12-month rolling period is because, as you know, we have very seasonal trends. So, for example, we're expecting to see more activity in the summer months and the Christmas period than we would see perhaps in the period that we're in now, the January, February, March period, when it's a bit colder. People aren't out and about and aren't doing as much in the local community. So by looking at a rolling 12-month period, it allows us to actually really understand what's happening in relation to crime, serious violent crime in the Bournemouth, Christchurch and Poole area. And I need to categorise this by saying the Home Office definition of serious violent crime does not include rape and sexual assault. But in Bournemouth, Christchurch and Poole, we have decided to say that rape and sexual violent assault is actually one of the key priorities for us, because we think it is so impactful on our local communities. So if you looked at national statistics, it wouldn't show rape, because the Home Office doesn't define that as a serious violent crime. But for us, it is very important in terms of the impact that it has on our communities, particularly those who are experiencing or fleeing domestic violence. So the most common types of serious violence in Bournemouth, Christchurch, Poole are sexual offences, sexual assault followed by rape, domestic abuse and personal robbery. There's been a I always struggle that with a statistically significant decrease in knife crime in Q4, 24-25. If you look at the lines, I don't know how well you can see that, but we really have seen a massive decrease in knife crime or knife flagged crime within Bournemouth, Christchurch in Poole. Knife flagged occurrences are on overall slight downward trends. Personal robbery has seen a consistent decrease, or not, although it's not. I said I can't struggle with that word. Statistically significant decrease, and the number of sexual assault offences have seen a consistent but not a statistically significant decline. So on the whole, things are getting better, and you can see that by the trend lines. If you see the trend lines going down and down there, but what we do see is a slight increase there. This is looking at domestic abuse. I'm just doing a snapshot. You have a lot of information in the papers that you've been given, but I'm just trying to give you a snapshot just to draw your eyes to the things that we think are of key importance to us here. So the number of domestic abuse flagged crimes are on a downward trend and have been decreasing since Q3 24-25. Q1 24-25 has shown a noticeable decrease in numbers. We are concerned, or perhaps skeptical, I don't know what's the correct word to use, around the numbers that we're seeing here, because there is a very big drop between Q4 and Q1, as you can see on the right of this slide. And we want to know, is that in relation to how crime is being recorded, or is it in relation to what crime is being recorded? To us, crime being recorded is the most important thing, so that we can look at where and when and what we need to do in terms of improving those outcomes for survivors of domestic abuse. So it may look good on a trend element, but actually, is that the reality for those who are living in those experiences? And that's why we want to understand more about what's happening. Antisocial behaviour is always something that is important to our communities. It impacts on every aspect of your day, on your life, and how you live in your communities. So again, this shows you that 12-month rolling profile trend, and this is a really positive, I think, news story in relation to what's happening in relation to antisocial behaviour. So you can see from between 2024-25, going right down to the latest data, we are seeing a rapid decrease in relation to antisocial behaviour, and no doubt that is part because of the government funding that has been channeled into local policing, local hotspot policing that's taken place. You'll also see the map. You'll see the little avocado here. That is Bournemouth Town Centre, as you all know, but the levels of police recorded antisocial behaviour are really declining rapidly, and we've seen a 6% reduction overall from antisocial behaviour that's been reported through to the police. There's some really positives here. That 6% reduction is also reflected in Bournemouth Town Centre, so it's not as though it's just been reduced across the whole of BCP. We're seeing massive reductions, particularly in relation to the activity that's taking place in Bournemouth town centre, which is our hotspot area. So if I wanted to talk to you about what we've done as a community safety partnership, it is not right for me to just sit here. I'm BCP Council. We are multiple partners that are related and working in the community safety partnership. But I'm going to highlight some of the really positive things that have taken place. So the Just Don't campaign, which you can see on the bus here, I think it's the most engaged with social media campaign that Bournemouth, Christchurch and Poole Council has ever had whilst it's been on community on social media in relation to the community safety partnership. We've undertaken knife crime campaign work, working with CAM, Community Action and other partners. We have the Sexual Violence Awareness Week. We have domestic abuse forums, domestic abuse perpetrator programs, which work across BCP and Dorset Council. We run those for Dorset Council as well. We have the stalking program which we're developing. There is no local stalking program, and stalking is one of the highest growth items across Bournemouth, Christchurch and Poole. We have the Harmful Sexual Behaviour Programme, HSB as we call it, which has recently been launched in November of last year. It's actually now being held up as a programme of excellence and is going into the Policing Journal in relation to how good it is in terms of how we need to go up cause and take that public health approach of addressing the cause of cause and looking at how we can change individuals, people's behaviours, perceptions of what needs to take place to address harmful behaviours. And we have the Safe Spaces programme. We now have over 200 safe spaces for people to be able to go and get help if they feel they're uncomfortable with something that's happening in their local community. And that could be for young people, it could be for people who are of a different minority ethnic experience, or it could be for individuals that just need a bit of help. So that's really grown. We have the Prevent Week of Action, which looks at supporting and trying to cure individuals who are at risk of being drawn into exploitation, particularly radicalisation or extremism. We run that every year, but this year we ran it for the entire Southwest, just to make sure that people could find safe and accessible routes to how do they identify, how do they express their concerns, how do they talk to individuals about what they might think is a behaviour that someone is exhibiting that might be linked to extremism or radicalisation. We've launched with the drug and alcohol team a cuckooing programme. So we have around 40 individuals who we're working with across BCP and probably I would say the wider Dorset area, because individuals often aren't just linked to BCP. They need to, well, they are linked outside of a particular geographical area. We don't draw boundaries on where we live and what we're doing, but looking at how we can support individuals who are at risk of cuckooing. And I suppose what's been really interesting from our perspective is that we all generally tend to think of cuckooing as young people, but what we're seeing is particularly an age demographic of individuals, I could call them young individuals if you'd like, individuals in their 50s to 60s, generally male, who are most at risk of cuckooing because of the way that they are trying to engage with people on social media. We've got diversionary activity taking place with young people. We've got ASB hotspot mapping. So we don't just look at what's the number of the data. We look at where is it happening and when is it happening. So we look at the times, the locations, what are the interactions between individuals? How do they know each other? Is there any cause there? Any links that we can look at doing? Again, diversionary activity around. We've developed the Unity Promise, white ribbon, which was a council motion to look at how we look towards developing white ribbon accreditation. We have experts by experience board, and I know a number of people sat around the room do this as well. It's about how we listen deeply, about how we listen broadly to individuals who are service users or who have experienced our services, and how can we do that better as we go forward, and how can they help shape those experiences. We have the Love Grace handbag appeal for those that you about the experience of Grace Milan, looking at how we can provide getaway kits for people who are fleeing domestic abuse, to make sure that they get just basic things like shampoo, toothpaste, the little things that you might need if you're fleeing domestic abuse. And looking ahead, what's coming up over the next 12 months? Well, we're looking at recommissioning our domestic abuse strategies and our services that are linked to it. We're looking at serious violence funding. That comes to an end technically on the end of March this year. We've been told there'll be a continuation of funding at a lower level, but it's unfortunately very much focused on priorities which may not be the priorities for Bournemouth and Christchurch and Poole. We're just working through that at the moment with the Police and Crime Commissioner. There is a national review of community safety partnerships and what is their role and what is their function. And I know Councillor Canavan is very keen on this and about how that sits in relation to going forward. Obviously, that links to the role of the Police and Crime Commissioner. We know that that's going to end shortly. And what does that mean? What's the oversight for community safety partnerships? There are a number of acts that are going through Parliament. We've got the Victims and Prisoners Act. We've got the Crime and Policing Bill. We've got a number of things that are coming forward, particularly relating to violence against women and girls. And we've got a lot of work to do around modern day slavery. There's a huge piece of work that needs to be undertaken there. So we'll be driving forward with a set of protocols, and not just for BCP Council, but for partners, looking at what we need to do around education and awareness relating to modern day slavery. And as I'm sure you're all aware, there is a huge piece of work to do around community cohesion. We're in a very difficult time, not just locally, but globally, in relation to what's going on, and making sure that people are heard and understood and really feel like they are part of the community and they can have their say. And so we need to make sure that we are enabling that, and most importantly, we are listening. We're very good at talking as local authorities or local government, but the most important thing we can do is listen. So looking at how we can listen to our communities and put in place mechanisms to work with them, to support them in the best way that we can. So that is a whistle stop tour. I'm really sorry if I'm not covering anything specifically in any detail, but hopefully the reports that accompany the presentation in the papers give you a lot more detail about what's going on in relation to the Community Safety Partnership. Thank you, Chair.
Thank you very much for that, Kat. I don't know that you did miss anything. That was so comprehensive and covered everything I could think of. So thank you very much for that comprehensive run through on Community Safety Partnership. I was going to ask for any comments, but Councillor Wilson, I suspected you might.
Thank you. There was one thing that Kat did miss, and that is that the Community Safety Partnership team won an award for their work. And I think that's important to highlight. It's a very small team, but a very hard-working and committed team. And I think the level of effort that's gone in, not just to this report, but the work alongside it, is incredible. I think some of the initiatives, obviously, safety is always an area where we need to be doing more, but I always wonder where we would be without the Community Safety Partnership and without the work of our team at the council in particular. So I think that's really, really important to highlight. I think it's always positive to see the statistics on a downward trend, especially around things like antisocial behaviour. But I do always take them with a slight pinch of salt, knowing how difficult it can be to report antisocial behaviour, and public perception as well being a key factor. But just as always, really important and good work going on from the team. So I just want to say thank you.
Thank you for that. Councillor Moore, I think, was next.
Yeah, thank you, Chair. Well, obviously, I've listened to the presentation previously when it went to the ONS board, and I have to say I did learn a good few things from it too. It is a really good report, this one, and I think it's good to have another opportunity to look and to reflect on the report. Because there's clearly a huge amount of work going on behind the scenes, and from lots of other different agencies in this area. But I also went to a presentation about cuckooing as part of my age-friendly work, and I think I can safely say that everyone there was really surprised by the fact that the biggest cohort of people being referred were actually aged 50 to 59. We all thought it was going to be something quite different, but we were wrong. And it was also a surprise to hear other examples of cuckooing could apparently come from grandchild to grandparent. And at the time, that really surprised us, and I certainly never thought of anything like that. So it was all really, we learnt a lot that afternoon. The question I was going to ask was at the end of the report, the government funding settlements mentioned. Can I ask about the current funding? Dare I ask about the current funding situation? Thank you.
Yeah, thanks, Kat. Did you want to?
Thank you. Yeah, no, absolutely. In relation to domestic abuse funding, we will receive exactly the same amount of funding that we received for the last 2 years, which technically is a 3%, may I say, reduction on funding. So although it sounds good, it's a reduction, isn't it, at the end of the day, because it doesn't factor in the cost of living increment that we need for the staff that are delivering those services or those commissioned services. In relation to serious violence funding, which is another one of our key funding areas that we get through, we have just been told by the Office of Police Crime Commissioner that the funding needs to focus on knife crime. That's what the government, national government, are telling them. And unfortunately, or fortunately, I should probably say, knife crime is not an issue for Bournemouth, Christchurch and Poole. The serious violence where we want to focus on is around VORG. It's around making sure that we're putting in place services to support women and other victims of violence against women and girls. And it just doesn't match. Serious violence funding is meant to be around what are the crimes that matter to you most in your local area, and using a public health approach, what do you think is the most appropriate means to address those? And that was what it was set up for, and now that carpet is being pulled out from underneath our feet, and we are not able to do that. So although there is funding there, it will not address the issues that we want to address, such as things like our amazing Just Don't campaign, or the work that we do with the nighttime economy around unity and working together. So yeah, funding is there, but it's not where we would want it to be, unfortunately, Sandra.
Thanks, Sandra. Zena, you can next.
Yeah, thanks, Pat. It was so interesting. I guess there's two things that I just wanted to raise. One was, I think it would be really great if you had some case studies in your report, because that really brings it to life, doesn't it? And it shows the impact. Not the stats are absolutely fantastic, but a narrative about how it's changed someone's life. It just really brings it to life. So I don't know if you would consider that. And then the second thing I just wanted to raise was, for obviously, we in commission we work a lot with older people, and there is this, I don't know if I want to say it's a myth, but one of the things about they say is that they're scared to go out and they don't feel safe, and that's for a lot of reasons. Can be the uneven pavements, but quite a lot of it is the fear of crime. Actually, when you read your report, actually it's not as bad as probably what they think it is. And how do we get these good news stories? How do we get these downward trends out there as communications to them, to Joe public?
You're on mute, sorry, Kat.
completely agree, Zena. We need to really break down that fear of crime, and we need the positive stories, as you say, to show the change, the difference that has taken place, whether in our local communities or whether that's things like BCP homes and that you did and you reported and this made a difference as a result of it. We were able to do something. We absolutely need to demonstrate that. And what I need here is a whole system approach to communications, and that's the ask that I've been putting forward from the Community Safety Partnership. It's not just about BCP Council doing and saying, I need partners to come on board, the police from coming on board, we need health and others and everyone to come on board and sell and tell and promote. You tell us what the problems are so that we can work on it. We can't work in isolation. So I'm 100% behind you on that. And I think the case studies idea, I love that. And yes, I will feedback to the team. We're planning now for our assessment for the next 12 months. I will ask for feedback. And if your colleagues, equally, this isn't just about what the community safety team do. What do adult social care services team do? What difference did that make? If you've got stories that we can put in as well, or anyone else who sat around the table virtually, physically, that can tell how you made a difference, give us those stories. Let's show the impact. Let's make a difference, and that will encourage other people to do it as well.
Thank you for that, Richard.
Yeah, thank you. Actually, what you've just been discussing is exactly the point I was going to sort of make and ask a question about, although I think you've probably answered it, because I was just looking at, when you talk to residents, when you look at social media, look at the press, knife crime is always up there, right at the top. Antisocial behaviour is. The whole stranger danger agenda. When these statistics are really interesting because it basically shows that stranger danger isn't the risk, is it? Because if you look at domestic violence, that is not stranger danger. That is people that are known very well to you. I would guess, it doesn't say, but I'd guess that a lot of the sex crimes are actually people that are known to the person. The crimes against women and girls are probably more likely to be people who are known. Except when people do their risk assessment, where am I going to be safe and not safe? People stay at home. In fact, often put themselves in places where they could be more at risk because they think they're safer there, and avoid places where they're probably less at risk. We all hear about going to Bournemouth Town Centre, won't go there because it's too risky. Well, actually, these statistics say it's not, is it? And yet, staying at home, it could actually be more risky than going out, if you see what I mean. So you mentioned about how to get that news out. I'm particularly thinking about young people, of course, because young people could be putting themselves in a more risky situation by misunderstanding where the risks are. Was your question there? I don't think there was there? No, but the question is how can we get that information out? I think really.
Kat, did you have anything to?
Councillor Burton is absolutely right. The vast majority of rapes are domestic abuse rapes. I can't quantify that and say that's good or that's bad. Do you know what I mean? In terms of it's not going to happen to you in a public open space. But when you look at the data, and if you looked at the data and it told you statistics about rape, it wouldn't allow you to see the data that we see as a community safety team that tells you that the vast majority is domestic abuse related. And that is really key. You are so unlikely to be attacked, hurt walking through local areas. It is domestic abuse related, unfortunately. And when you look at sexual assaults and the link between individuals who are known to each other, and we've talked about this before, our particular focus is on young people, because a number of the sexual assaults, a high number of the sexual assaults, and you must all bear in mind the definition of a sexual assault. It could be a pinch on the bum. You know, it doesn't mean it's something extreme or graphic, but it's a sexual assault. They are individuals who are known to each other, and a high number of them are young people who are known to each other. And that is why we have put in place this nationally upheld harmful sexual behaviours programme, which has been approved by the Children's Safeguarding Board, to try and address that, because of the issues that we have seen through children being exposed to different things through social media, through lockdown, etc. We are not an outlier. This is a national issue, and that's why the national government, has said that they need to address that. But we've looked to address that before the government even did. So BCP are leading the way in relation to addressing a number of these issues. And I think it's really important, Councillor Burton, that you've highlighted that, because it is really important in terms of how we need to move forward to break that cycle, to go upstream, to really change those behaviours, and look at how we can make sustained systemic change to make sure that we are looking after the future generations and how they look at healthy sexual or non-sexual relationships going forward.
Thanks for that. Mark, did you want to?
Yeah, thanks, Kath. Really, really sort of comprehensive report, and as I think Councillor I said over there, Councillor Moore, really factual and a lot of learning to sort of read through it. Great to hear about the breadth of work that's going on and all the positive impact that's happening, and seeing those downward trends. I suppose one of the things that I'm keen and just thinking through is thinking the broader context around that impact, and thinking about broader impact on health. So there's something for me around whether or not we need to or want to consider, as we start to talk about neighbourhood plans, actually where do we bring this in as well? So thinking about the wider impact on people's health and well-being. And I think there's a real opportunity that, just thinking about the communications piece, using our local communities to really push out some of these messages as well, which I know we've talked about before, around how do we use communities in the work that we do and our trusted partners to start sort of highlighting some of these messages in a positive way. I'm just thinking about the thing that you just said around sort of, oh, don't go to Central Bournemouth, or these myths that are out there around knife crime or what have you. There's possibly an opportunity for us to think that through. And I suppose I'm just thinking about the trauma that's associated with some of these things as well that you're talking about, all have a massive impact on our health services and people coming through. So I guess I'm just putting it into the room really, right, drawing that strand together with some of the work that we'll be doing in the coming months around neighbourhoods. Thanks.
Thank you. Any other comments or feedback or questions for Kat? No, I think, thank you for that range of questions actually, and Kat, thank you for the report and for those responses. For me, I just wanted to pick up a couple of bits. I totally agree with Zena actually about the sort of case studies, you know, certainly within adult social care strategies and stuff. We often talk about those sort of stories of difference, about how individuals have been impacted by services. So I think that would be really helpful and really useful. And I very much agree with Councillor Burton about this perception of crime and safety being totally different to the reality. I remember a few years ago knocking on the door of a neighbour of mine, and you know, this is in North Pool where it's very quiet, not a lot happens. I'm out almost every evening walking my dog around the area, wandering down to the shops or the social club or whatever. And this lady said, you know, when it gets dark at night, she literally would not go out of her front door after it gets dark because of the fear of what was going on out. And I just sort of look around the streets and I think there's nothing going on out here. And it was really, my heart really sank. I think you're living in one of the safest parts of Dorset, one of the safest counties in the country, and you literally, through fear, will not go through your front door as soon as it gets dark in the evening because of your perception of what's going on in the area. And I thought that really does impact people's quality of life and them living their lives. So I think that's a really important bit. And you highlighted the Just Don't campaign, and I think that's a really good example of learning from other areas, wasn't it? I sat in my car behind a bus the other day and read the Just Don't campaign advert that was in front of me and saw that it's from West Yorkshire Combined Authority that sort of launched it a few years back, and it's proved that it's worked well. So we've sort of nicked that off of them as well. So so yeah, I think that's a real positive that we're sort of learning from national best practice. So right, okay. Oh yeah, Kat, did you want to?
Yeah, that cost us a whole pound, that campaign.
Did it?
I'm really pleased about that. They were so delighted to be able to share that campaign across other areas because they so believed in it. But I just want to say, obviously, I'm here presenting on behalf of BCP Council, but there are multiple partners involved in this, and I just want to pay credit to everybody who's involved in that, not just statutory or authority partners, but the community and voluntary sector, people like STARS. They play such a massive role in delivering what we're trying to address in terms of the community safety partnership agendas. So it's just a huge thank you, Chair.
Thank you for that. And yeah, the recommendations in our report are just members to note the progress of the Community Safety Partnership during 2025 and note the compliance of the BCP Community Safety Partnership as set out in the relevant legislation. So I think we're all happy to note that, and thank you all for your comments and questions. That was really helpful. Thank you very much, Kat. Okay, we will jump on to agenda item 9, which is our sort of regular Better Care Fund. So looking at 2025-26 Q3 reports. So Scott and Zena, did you want to?
If I just come in a little bit, because unfortunately there's been a slight delay in the national guidance and framework for the Better Care Fund of 26-27. So we were hoping to bring the draft plan, but unfortunately we won't be able to because obviously the planning documents have only just been released 23rd of February, and also that there's the national webinars happening that Scott and colleagues from the ICB are attending. So we'll start preparing that plan in early April. But sort of the clear sort of guidance coming out from those webinars is that it is going to be a transitional year, 26-27. No significant changes, no rebranding. And so we just really continue what we're funding now, but with a view that in the narrative that we're going to prepare, it is about what we've all talked about this afternoon, is that we have to have that drive direction from cure to prevention. So that's where we're at, and obviously align with a 10-year NHS plan and obviously local 5-year plan. So it's about stability this year, when we're hoping then we will bring the draft report on 29th of June, the next Health and Wellbeing, if that's okay, Chair. We'll just email you and Laura just to get that consent on that. And we're going to get further guidance from national BCF later this year about that plan for next year. So it'll be a lot of change next year, but this year is about stability and a transitional year. I think probably that's it really. If I'll hand over to Scott and Jenny, I think it's online from oh yes, good to see her. That's okay.
Thank you, Zena. Good afternoon, everyone. So I'm here today to present the Q3 report for the Better Care Fund for 25-26. So I'll just go through a few bits about what was reported. So we went through the confirmation of national conditions, an overview of the performance of some of the metrics in Q3, as was originally set in the BCF plans that we brought to the board earlier this year, and the expenditure that was spent between April and December last year. And that data was collected in partnership with our scheme leads, members of the ICB, and some of our wider system partners as well. So overview of the national conditions. So we've got a Section 75 agreement in place, which is a financial arrangement. It just formalises that partnership with the BCP Council and the ICB. And we also put into place that the plans are jointly agreed, and the objectives of the BCF are being implemented. So we're having regular meetings with the ICB, and of course we bring these reports to the Health and Wellbeing Board every quarter as well, just to ensure we follow that oversight support process. I'm going to pass over now to Jenny to share some of the metrics of the hospital stuff over Q3. So over to you, Jenny, please.
Hi. Yes, we're on track to meet our hospitalizations for our population over the age of 65. And we think the area that's really impacted this, particularly in the East, is the work that we've been doing via Future Care and the alternatives to admission. So we've been working with our SDECs to increase flow through SDECs to get patients home the same day and out of ED. And that has seen a reduction in people being admitted through those pathways. In terms of discharge to delays, we're not on track at the moment there. It's important to note that when we submitted our trajectories to NHS England, they were aligned to the Future Care benefits and where we hope to be at this time, and we're a little bit behind with our discharge delays and realising those benefits at the moment, but we are starting to see some positive impact in that area. So hopefully from Q3 onwards, we'll see that play out through the plan here. And Scott, did you want to cover the residential admissions?
Yes, thank you. Yeah, so just quickly going over the residential admissions. So we're continuing to be on track to meet target, which we have been in the last 2 quarters as well. So it's been lower than expected. We saw 332 residential admissions year to date. So we've continuing our strong focus on prevention and early intervention, which is continuing to reduce long-term care demand. And then we are working alongside our colleagues in housing who are delivering housing adaptations. So we've had 150 new adaptations installed year to date. There's been progress in the Adult Social Care Hub at BCP Council, and we've expanded our reablement capacity. And as well as we've got a community reablement pilot currently running that's helping people to stay independent as well. And then let's quickly go through the expenditure. So year to date, so we can kind of see that we're about 75% spent. So everything is on track. Just one thing to note in Q3 is that we received a in-year uplift to the Disabled Facilities Grant, which was to the tune of £307,000 for BCP Council. So housing will be using that to install even more adaptations, so that will help enable more people to stay home independently. And then I'm just going to move on from the Q3 report, and Zena alluded to about the 26-27. So I've just got some early slides I can share here, which just to address to the board, showing you what our indicative allocations will be for next year. So we can see we've got a 2.95% uplift for the minimum NHS contribution. And within that, we have to have a 4.4% uplift towards adult social care spend. So we're working with colleagues in the ICB just to make sure that is the case. With the local authority Better Care grant, that will be at standstill. So we've had that standstill for the last 2 years now. So we may see some pressures due to that. And then with the Disabled Facilities Grant, we have got a 3.6% uplift. But if you include the in-year uplift that I mentioned just a moment ago, it does look like a reduction, but it might be a case we have another in-year uplift, but we'll see that whether the government decides to award that later in the year. And then just to go through some of the planning framework that was released last month. So we've got the national metrics. So some of this is similar to what you've seen from our previous reports. So the emergency admissions was 65 plus population, along with the delayed discharges. And then they've asked us locally to set local goals. So we can look at residential admissions and reablement outcomes, which some might be familiar with, we used to report on. So we're looking into including that into next year's planning. But all these metrics have to be agreed across the system, but we'll share that in due course. And then, as we've discussed several times today, the neighbourhood health teams. So there's an emphasis on that integration between BCF funded services to strengthen that multidisciplinary working and just have that better alignment of local resources. National guidance states that national health teams will play a central role. As Rob alluded earlier, that the guidance hasn't quite come out. So when that does, we'll be able to work closely together to ensure that those plans are in place alongside one another. And then just quick, this is sort of what Zena's already said, is about this. This will be the first formal year of the BCF reform. We are expecting more guidance later in the year to show us how they want long-term planning to look. Some rumours previously that they were going to rebrand the fund, but actually they're just keeping it as the Better Care Fund, seemingly for the time being. And the Department of Health and Social Care said no major changes to funding this year, but they want us to state in our narrative what direction we're going to be taking it to, and you know, as you will see when the narrative comes out, sort of what we aim to achieve over the course of the year. And then we've got the deadline for that submission to be the 19th of May, which we hope to present to the Health and Wellbeing Board on the 29th of June. Thank you.
Okay, thank you for that. Any questions or comments? Siobhan, did you want to?
Just thank you for giving quite a concise presentation about it. I suppose I can't really sit here without saying it looks like everything's on track, and that's great. From a sort of provider perspective at the moment, there still is incredible pressure in terms of no criteria to reside patients in the wrong place in the system. So it doesn't actually feel like we are on track, and I suppose it would be good, and Laura, I think it would probably be really good to have a conversation about how we can reset a few things to really see how we can have a bigger impact in terms of ensuring people are in the right place in the system. So just a bit of a query about some of the metrics. And I think our colleague on the screen, you said that you hope that they will have improved in Q3. I suppose I'm reflecting, there's quite a lot of pressure at the moment.
Okay. Thanks for that. Laura, did you want to?
Yeah, thanks, Siobhan, and I echo that, and I agree. I think the risk is, isn't it, when you see things on track, that it's masking actually some of those issues that are actually happening across the system. And we have been under pressure and have had quite a hot system, if you like, for quite a significant period of time. So non-criteria to reside, I think, is right. Discharge delays not being on track, I think, thank you again, Scott and Zena, for highlighting the mechanisms that are in place. So I think, Siobhan, to your concerns, you know, trying to get grip on that. So the enhanced caseload management, the escalation pathways, commissioning to address gaps. So I think what I'm hearing is that, albeit that not all of the guidance is out yet, I don't think we're saying that we wait until April till we review. We review now and make sure that we've done as much as we can this year, albeit a stabilising year, so that we've got a firm foundation for next year and we know exactly what changes we want to make in alignment with the national guidance about neighbourhood teams. So I think, I guess, from my perspective, and picking up on Siobhan's points that are very valid, I think we can't afford to wait. We've got to have a bit of momentum, haven't we, in taking stock and seeing where we are at the moment and what we can do in the immediate term whilst laying the foundations for the longer term.
Thanks for that. Any other comments or questions or responses from anybody? No, that's really useful. My comments, actually, what you covered right towards the end there, Scott, about the government wanting to sort of line Better Care Fund with their sort of shifting from treating sickness to prevention and that sort of thing. I remember a discussion at the Integrated Care Partnership a year or more ago about what the Better Care Fund was doing, and actually talking about prevention. Do we need a better prevention fund? And it feels like the Better Care Fund is sort of transforming into that, funding very much all the sort of prevention agenda. And I guess that's where it has to go, doesn't it? Because we've already started to see a bit of the sort of results of what we do if we actually really concentrate on the prevention agenda. Just in terms of future funding, obviously there's a freeze to our local authority element, and I know from what I'm told that's the Better Care Fund allocation of about 16 million for the local authority will then be rolled into our revenue support grant from government, so it won't have a sort of separate line from government. It will just be part of the revenue support grant, which is then overall being reduced over the next couple of years for BCP, not to other authorities, I think it'll be increased, but ours is being reduced. So it's whether you've had any sort of indication or confidence from that actually the element of our revenue support grant for Better Care Fund will be maintained, or whether it will be sort of frozen or what.
They haven't shown much indication of the local authority better care grant following 26-27. While they've shown like the NHS minimum contribution, we've seen that beyond. I think at the moment they are still sort of finalising some bits of it. I know there were like discussions about it being absorbed into the revenue support grant, but from the early discussions I've heard, I've not seen that still be part of the conversation.
And I think for me that's the concern. If it's part of the revenue support grant and this new supposedly fair funding formula or unfair funding formula, you know, where actually different authorities are getting different experiences. Some are getting big uplifts in their revenue support grant. We'll be getting a cash reduction each year in ours. So that's my concern, that actually it will then be wrapped into a different funding formula, which is related to different things that go on within the BCP area. And yeah, that's my concern, is about pressure on the Better Care grant element of the revenue support grant. So yeah, look forward to sort of actually getting more clarification on that as sort of government announcements come through. So any other questions about the BCF, or just our recommendations are that we as always actually we retrospectively approve the Better Care Fund 25-26 Q3 report as distributed. So we're all happy with that. I don't know what would ever happen if we say no, we're not happy to retrospectively approve it. Yeah, I don't know. Interesting question. Right, okay. Thank you for that. Nods all round. So thanks very much, Scott. Thank you, Zena, and thank you, Jenny, as well for updating us. Okay, the next agenda item C, CQC assurance visit outcome. Just I think we were looking for a verbal update. Betty's not here today. I don't know if anybody else has got Zena or Laura got it.
I think it will be very brief, Chair, which is that we don't have an update, sadly. So colleagues around the table will know that we had anticipated that we should be receiving the outcome from CQC, but we have not yet to date. Obviously, we have chased that and we'll keep everybody informed.
Yeah, because it's now 3 months since they visited at the beginning of December, isn't it? So
Indeed.
Yeah, I think we were hoping to hear in January, weren't we? So, but I don't know whether it's a good sign or a bad sign. Actually, you just don't know, do you? Actually, whether that's okay. Thank you for that brief update. We will look forward to further news on that as it happens. Can't be long now, can it? Surely. Then agenda item 11, our work plan. Obviously, it lists what we've covered today. We've got scheduled for our June meeting. Obviously, as we've just talked about, the Better Care Fund is on the agenda for June as well. Gambling harms needs assessment. I know, Rob, we've spoken about that, so if that's still okay for our June meeting. And we were just talking a bit about that at our cabinet, sort of our informal cabinet earlier today, and the difficulties that and issues that have been raised through that. But I think that's a really valuable piece of work to have that. So, is there anything else? I guess we'll have on the CQC assurance visit outcome verbal update. Hopefully, Rob, did you want to?
Yes, Chair, we will have our health and wellbeing strategy
for
the next meeting. It's currently out to public consultation, which closes at the end of March.
Yeah. Actually, I'd like to just make a public service announcement that actually, yeah, the health and wellbeing strategy went out to consultation, public consultation in mid-February, and it's running till the end of March, isn't it? So if you want to click on the, I'm sure you're always regularly looking at the BCP, public consultations, but actually if you go on there now, on the front page, it's the health and wellbeing public consultation and the learning disability partnership big plan consultation are the two key papers being consulted on at the moment. So at the Have Your Say BCP website, if anybody wants to go on there and go through and answer some questions and give us your feedback on that. So so yeah, that will be really useful when we get the feedback on that. So, Mark, did you indicate? Did you want to?
I was just wondering about the neighbourhood health plans, whether we put a placeholder on them for June. At that stage, I would hope that guidance has been published, and clearly we want to get on with the work anyway in the meantime. So.
Okay, yeah, if we'll put something in for June on neighbourhood health plans, yeah, that'll be good. Okay, any other thoughts on the work plan? Oh, we got one. Oh, Kat, did you want to come in? So.
Chair, if I may, I don't know if the board would be interested. It's the end of the 3-year lottery access to food partnership programme, whether chaired by Sandra, obviously, would want us to bring forward the report that we have at the end of year to sort of reflect on what activities taken place for the last 3 years, but also to inform members who have a key role in promoting the Crisis and Resilience Fund going forward for the next 3 years as well. So a wrap up of what we've done, but also about this is what we're doing going forward and how you as anchor organisations can help to signpost and support your employees, your contacts, your individuals in accessing any support that they might need.
Okay, thank you for that. Sounds like a good suggestion. So yeah, we'll liaise on that. So thank you. And if there's no other comments, I'm glad you there was no hesitation and repetition and everything else, and we've actually managed to keep well ahead of time, and gives us all time for a quick cup of tea before we go to our next meeting. So thank you everyone, and I'll close the meeting.